Welcome back to She Really Gets It. I'm Stefanie Rhodes, health educator and reformed public health professional. And this week we'll be discussing why is public health so racist? So for today's episode, I have a special guest. And the reason why she's on is because, my journey into public health started in the city of brotherly love, the city of Philadelphia. And our guest is Ms. Janae Jeter. She is a native Philadelphian. She is my fellow Drexel alum. She is currently a PhD student in public health at Johns Hopkins University. And she is currently a visiting professor of public health at Arcadia University. So Janae, welcome to the show.
Thank you. I'm so excited to talk to you. At Drexel, you are one of my favorite people. So this is good.
Same. I used to harass Janae every day, everyone. So.
It wasn't harass. I would say we bonded.
I love
so yeah, girl.
It's just
let's talk about this
at work.
Yeah, let's talk about this public health stuff that we got ourselves into.
I know. Let's talk about it. So, I'm going to start by talking about just, I think about racism in public health. I think about a lot of times it's hidden because we don't call things what they are, right? I think there's a lot of terminology that we use that's very broad. So for me, if anyone who's ever listened to me go off on social media or to them directly, I hate the term health disparities. I think it's so broad. And I think that people who aren't in the field of public health don't even know what that means.
Right.
But we use it routinely to describe racism, sexism, homophobia, poverty.
Everything.
Right?
All the things.
Everything. Health disparities. When COVID kind of came around in 2020, right? Health disparities.
Right.
Doesn't know what that means. They know that Black people are dying disproportionately.
Right. But they don't understand why and everything that comes with it. Yeah.
Right. And I think what happens in public health, and even with professionals in public health, but I think a lot of times our white counterparts, I feel like even they make the assumption of there must be something wrong with Black people, or there must be something wrong with people of color. That's why this is happening to them. And the approach that they take, that's exhibited, right? We're going to have programs that target the behavior of this particular group of people, as opposed to it's not that the problem isn't their behavior, right?
It's systemic racism and just all of the things that have essentially pushed a lot of Black and brown people into the situations that they're in, whether it comes to schools and health, whether it comes to community violence, gun violence and health. All of these things are connected. And so in terms of public health, we've seen that this realm is dominated by white women. I know that definitely in our program, the mass majority of people that were enrolled in our cohort were white women, and I think followed by Black women, just because in health in general, aside from doctors, nurses, public health, it's mostly women. Even my students, there's mostly women. And so all of the things that kind of come with the prejudices or even biases that we've talked so much about in school, that come with white women, that is kind of exacerbated, when they implement programs and things of that nature. Exactly. And so we can't be surprised that a lot of the initiatives and a lot of the programs that are geared towards Black and brown people, but let's say specifically Black people, aren't necessarily sustainable or successful. It's not necessarily a surprise.
Yeah. Yeah, I think when you go into a situation, right, and you've already assumed there's only so much we can do, and, certain things are inevitable. You design a program with that assumption, right, already in mind.
Right.
Certain things are inevitable. We're going to do the best we can. We can address it. We can't really fix this problem, because fixing it often would mean that certain people aren't going to have jobs anymore.
Yeah, and I know that we talked about this before, and just if you solve all of the issues, what will we have left to do, right?
Yeah.
But honestly, I think that humankind is messy. And I think that there will always be some type of cyclical issues, right? And so we talk about in public health, especially in epi, we talk about just the disease transmission, right? And so what are the things that have historically have killed mankind? So of course, in the beginning, it had to deal with famine, it had to deal with biological agents and things of that nature, whereas we progressed in technology and healthcare. So now a lot of our deaths are caused because of chronic conditions and humankind conditions. And so that's just something that I think will continue to happen regardless, if we continue or not to be in this realm.
Yeah. I think, but there's that inherent fear of like, okay, if we solve this, where do we go next? And I'm like, we got to solve this. We got to move on, right? We've got to move on to whatever that next phase is. And I feel like we're kind of stuck in a gear, right? But moving on, I think we've kind of touched on it a little bit, talking about the fact that, public health is very white, female dominated. And I think that's when that kind of notion of white saviorism comes into play. So I know for myself what white saviorism means to me.
Right.
I want to start with, what does white saviorism mean to you?
This is touchy, right?
Yeah.
And so I think a lot of that, especially in the realm of public health, is that, okay, people that come from, low income backgrounds or, low socioeconomic status, all of the buzzwords that we have in public health, right? Yeah. And so let's use our knowledge and our smarts and all of our essentially privilege, right, to come into your neighborhoods and to tell you what you're doing wrong and how to solve it. Yep. And so I think that that's an approach that has been used historically. And I think that more and more culturally competent public health programs are trying to move away from that in terms of when we're talking about engaging your stakeholders and making sure that there's buy-in, because if there's no buy-in into a program, if you're not talking to the people that this is actually impacting, you're not going to have the impact or the results that you think that you're going to have. Yeah. And I think an example of that is when I worked for the Philadelphia Health Department in the AIDS Activities Coordinating Office, also known as ACO. There was a spike in positive HIV cases among white men who use intravenous drugs. And so they wanted to create palm cards specifically for the area of Kensington and Philadelphia. If I'm sure you know, Stefanie, but if for the folks that are listening, Kensington is essentially, if I were to reference a good show, The Wire, which they essentially had all of the drug use out in the open and all of the drug dealers and such. That would be Kensington. I know that a lot of the youth or the young people call it zombie land because there are people that are walking around essentially on drugs and high, and it's an open market, right? And so this initiative was targeting white male intravenous drug users that were in Kensington because that's where the spike was coming from. However, the person who created these palm cards, a white woman, did not engage the agencies that serve that population, didn't engage any type of clients that we provide services to when creating the palm card. So when the department created it and printed it and tried to distribute it, everybody's looking like, what is this? Because do you really expect someone that has just used drugs to read all of these words on this palm card? Yeah. Do you really expect a lot of people to even pay attention to the information that you're providing on this palm card. Do you really think that they're going to use it for the things that you think that they're going to use it for? And so I think that that's an example that sticks out to me in just my career working for the government. How, white saviorism, or even just not including your stakeholders, has an impact on public health programs.
Yeah. Yeah. And I think, like, for myself, it was always kind of like shocking, like going into these like organizations that have, they've got great reputations, they've got really big names. And then you see like, oh, wait, it's an all white leadership team. It's an all white leadership team. They're supposed to be like designing programs for the public, right? But they know nothing about the public, right? Like these are some of them represent like the wealthiest people in the nation. Right. The most privileged people in the nation. They've always had access to excellent health care. They've always had access to these things. And they're coming in and saying, well, this is what's wrong with you. Right? This is what's wrong with you. This is how you need to change your behavior. As opposed to, you know what, maybe I've been stealing all these resources from you.
Right. And there's always, this like this expectation. And I don't necessarily know too much about the nonprofit space, Stefanie, just because I've been essentially in government since we graduated for the past 10 years or so. And so I know that from my friends who are in the public health realm, that it's a bit more toxic in the nonprofit spaces. And I think that's because with government, often, especially in a place like Philly is a union town. So if I'm a city worker and you're saying something crazy to me, I'm going to the union. And I think also because I was a shop steward, I was involved in my union. I come from a union family. I think that there were certain things that folks weren't going to do in a governmental space, just because of the accountability that's kind of ingrained in policies and procedures and stuff. But just some of the horror stories that I've heard from you, from other friends about nonprofits, it's definitely where you have the entry level or even boots on the ground be predominantly Black and brown people. And then when it comes to supervisory or even managerial or directorships, it's not reflective of the population that's being served
at all.
And so I think that that's inherently an issue when we talk about, even in politics, why aren't there more women in Congress? Why aren't there more people of color in Congress? So if you don't have a body that's reflective of your country, of the population that you're serving or you're even in, how do you really think that the issues that you have on a regular basis are going to be addressed if those folks have never walked in your shoes before? And I think that that's something, like I always say, to my students, don't come into these spaces thinking that you know everything. Yes, you have the book smarts, but they have the lived experience. So instead of you thinking that you're, in charge of this program, think of it as a collaboration. Think of it as a coalition. Think of it as a partnership. All of the words that we learn in school. Just because if you don't think of it in that way, your program is not going to survive. Well, we don't have enough money in our public health infrastructure as it is for programs to be a waste of money.
Exactly. And honestly, I love that you bring up unions, because in my most recent position, I was in a union. It's my first time being in a union. And it was amazing. All of a sudden, like, it wasn't just me. Like, if someone harassed me or made a racist comment, it wasn't just me like going to HR. The union was like, no. HR is not your friend, which is something that I had learned at that point, being in nonprofits for long enough. Like, HR is not a friend of the person that does the labor. They are not the friend of the staff. They are there to support leadership and whatever leadership wants to do. Honestly, and I'll be very honest with you, with any nonprofit, and I don't care whether it's just like, Save the Children, but I'm not trying to like call them out. I don't know anything about Save the Children, but I'm just making up stuff right now. But, the little like cute little do-gooder nonprofit that provides, free breakfast or free lunches or free dinners, to children. or like the big hospital system that's also a nonprofit, they will actively violate labor laws.
Mm-hmm.
That is the truth.
Mm-hmm.
Actively do it, and nothing happens to them. There's no union to hold. There's no one to hold them accountable.
Right.
Like if you want to hold them accountable, you're gonna have to do it yourself. You're gonna have to get an attorney and have to pay for it, right? If you're in the union, they're paying for the attorney. That's what your union dues are for.
Right. Right.
You know, you have all of this collective support. So when I see all these hospitals, like I think when I first worked in a hospital, I remember the hospitals were like, oh, we don't like unions. You know, unions prevent us from doing good work. They prevent us from like making necessary changes, you know, to keep patients safe.
Mm-hmm.
Which is complete BS.
Yeah.
Bullshit.
I mean,
it's like, because the truth is, like, if something, let's say I'm a nurse, or even like when I was a health educator at a certain hospital system,
mm-hmm.
if I noticed that something was wrong, or a patient was mistreated and didn't receive the appropriate standard of care, I'm not just worried about the safety of the patient. I have to worry about my job if I say, like, what really happened.
Exactly. Yeah.
Right. And I really want to make people aware, and I really want to make sure this doesn't happen again. Good luck, because there are people in leadership that are very invested in not addressing that, because it could, for any number of reasons. It could be money, it could be fear of being sued, it could be because they happen to like that doctor, or they happen to like that nurse, right? So for me, I'm like, no, unions are necessary, right? In order to keep patients safe, in order to protect the public's health. You need unions, because those people that have their boots on the ground, they're doing the work, need to feel safe saying, hey, this is happening and it's wrong and it's causing a serious problem. And they need a union behind them to protect their job so that they can do their best work without fear of some type of reprisal. So I will say it was always interesting working in nonprofits, like public health nonprofits, where there were no unions, but they were talking about equity, social justice. And I was like, y'all don't even have unions. And in fact, some of y'all are staunchly anti-union.
So what do you think in regards to just equity and social justice? What are your thoughts about that? Because even though, you know, they're etched in public health, I don't really recall equity and social justice being as talked about or and emphasized when we were in our master's program compared to how it is now.
Yeah,
would you say the same thing? I don't know.
So for me, like, not really. So I think it was I remember one professor made the comment, and it's like a community health class we were taking. And she made the comment essentially like, you know, you can't save everyone, you can't fix everything, but you can save your little starfish. Find a little starfish to save. Like, she was actively, you know, in front of a crowd of us, like advocating for like white saviorism. Like, and I think about it, I was like, save your little starfish. Like, if you can save just one child, just one, that's enough. And it was like, what? Aren't we in public health? Like, isn't the whole goal to change systems? Like, that's really like to adjust systems so that we have access, you know, to clean water, affordable housing, you know, like even during COVID. Yeah, it should be our mission as public health providers, public health professionals, to like say, like, you know, you can't evict people during a pandemic. Are you crazy? Like, you shouldn't be evicting people for anyway, but you know, but no, you can't do that. Like, we're trying to protect people's health and safety. And so there was always that mentality, at least I know in our program, where people like, save your little starfish. And you saw the people that were, in my opinion, that were elevated, supported, had that same mentality. Like, they were like, I went to South Africa and, you know, fed babies and
Africa, Indonesia or something. And so at the end of the day, I don't mind when people have had a trip that inspired them to be in that field, just because I think that getting out of your comfort zone and even traveling in general just opens up your mind and your perspective when it comes to just life. I say that just because I've traveled a lot over this past summer, probably the most, you know, out of the country that I've ever, you know, have spent.
Yeah.
And so I don't have an issue with them having that perspective after having a trip, right?
Yeah.
But I think what I try to emphasize in regards to just the prejudice or even the privilege that's rooted in systemic racism, right, is thinking that you can come into spaces and just do what you want, how you want it, and think that, it's going to work, right?
Yeah.
So I think that also, and we kind of touched upon it. I know that when I did work for the health department, and I know I had told you about this as well, but when I worked for the health department, the workers, especially the Black and brown workers that worked within the community-based organizations that the city funded, they called themselves like the field slaves. They actually used another word, but I'm just going to say field slaves, and said that the Black and brown people that worked in the actual department and for the city were the house slaves. And so it was crazy, because it was like, I knew that the way that the health department was so structured and all of the things, I'm thinking in my head, okay, well, a lot of our funding is from grants too. And I understand, we have to have time and effort for grants and things of that nature. But Stefanie, when I tell you, I left the health department and went to the Department of Behavioral Health, because behavioral health used to be a part of the health department, but it branched off just because it's a huge entity, right? Yeah. And so when I went to the Department of Behavioral Health, still within the city of Philadelphia, I felt like I had not Stockholm syndrome, but I was just like, oh my gosh, I can do this. I have flex time. You're not forcing me to take a break, or, and certain things where it was just like, oh, you're treating me like an adult.
Yeah.
And so I feel that oftentimes people of color are, I don't know if I'm saying this word right, but infantized.
Yeah, infantilized. Yeah.
Infantilized.
No. Yeah. Absolutely. Absolutely.
Kind of thinking we aren't up to par with handling our duties, despite the fact that Black women in America are the most educated demographic in the country. But that's besides, we can talk about that another time. But the fact that, your higher ups, and oftentimes in the city, especially with the older folks, like the Gen X or even some of the boomers, the folks that worked under them, we had higher degrees than they did. I know, my director, when I was working for the health department, he only had a bachelor's degree, but he had a bachelor's degree from Harvard. So it was and he was an activist. He was a part of ACT UP in the 80s and the 90s. So it's he was on this pedestal where you have people that have master's degrees, you have medical doctors, you have all of these things, and we're all under this guy that has a bachelor's degree. Not to say that he wasn't smart, because he was very smart, but oftentimes the workers made him look even better because we were just as educated, and also providing him with tools that we learned or from trainings that he may have gone to. So that's another thing where oftentimes in public health, there aren't options to rise or to move up along the career ladder. And so, or there are opportunities that are opened up for certain folks and not for others. Yeah. I have seen that a lot happen a lot as well, where, you have certain managers or certain directors that take to a certain person or a certain group of folks and just kind of ensure that they are able to kind of navigate and to grow within their career. But I can honestly say, until I left the health department, I don't really feel like I was growing as a professional.
Yeah.
I learned a lot.
Yeah.
I learned a lot about hands-on program evaluation, because I was a local level project officer. But at the end of the day, in terms of just my growth as a professional, and not necessarily my growth in terms of skills that are related to the job, my growth as a professional, I didn't really feel like I grew too much. And that's the other thing. We don't want public health to become stagnant, just because, as we can see, whether it's COVID, whether it's the monkeypox, whether it's the next, epidemic, pandemic that may arise, we kind of have to stay on our toes. And so, that's some of the things that I experienced. But yeah, give me another question. What else?
Yeah, no, I like that. And you brought up so many really good things, even thinking about, because I don't have an issue with people like traveling, to Africa.
Gotcha, yeah.
My issue is the power differences, right? So if I think about, so if you're coming into, let's say I'm a native South African, right? I'm a Black South African. And you have these white kids from the Peace Corps coming in, and they could harm me, they could do whatever, and there's no accountability, right? Like if they kill someone, rape someone, they're on a plane back to the U.S. and the embassies got them out of the way, and maybe they'll pay a fine, maybe, right? If that, probably not. But that's the issues, and it's that lack of accountability.
Yeah.
And so for me, that's when those power differences aren't recognized and really acknowledged, right? It's like, no, I can't. How do I trust someone who I can't hold accountable? And and I think within public health, when I think about like those power differences, it's not just as simple as, all right, okay, they're all white women in leadership and all the Black women and brown women are down here. It's the power difference, right? It's if you're harassing me, right, and I'm trying to like improve the public's health. I'm passionate about my community. I really want things to be better. I want Black women to stop dying in childbirth. Right? All that.
Yeah.
But I got to focus on being harassed by my white boss because I'm a Black woman who she thinks has stepped out of her station.
Right. That reminds me of a situation back in the health department, right? Yeah. So my supervisor at the time had resigned. She was a Black woman, and she resigned when the director that I was talking about, when he was promoted to the director position. Yeah. And so I would say not even 2 weeks after he was promoted, she put in her resignation. And so I was under her in addition to an older white man. He was older than the both of us. She was probably no more than 10, 15 years my senior, whereas he probably was retirement age, if not. Yeah. And so when our manager kind of went through all of the things, all of our duties and responsibilities, she was just like, oh, I didn't know you did this. I didn't know you did that. There was like a plethora of things that I was doing on a regular basis that they had no idea, just because it was running so smoothly, right? And so there was a task that she wanted, the manager, that she wanted to have my coworker, I guess, be able to do. And so this was using coding, and I've told you that I've been doing coding since high school. I went to a high school for engineering and science. Shout out to ENS in Philly. And so this was like common for me. And so he ran the test. He came up with different results, different figures. And so our cubicles were next to each other. And so I could hear him talking to the manager, and she's like, why is there a discrepancy between your report and Janae's report? And this man said, well, Janae lies.
Wow.
And he said it in like a jokingly way, but it's like, my guy, I don't even talk to you that much for you to sit up there and say that I'm a liar. So instead of saying, oh, I'm not sure, let me talk to Janae to figure out to mitigate this discrepancy, because, Janae's been doing this task for the last however many years. And I've only done this for a couple days. So the fact that in his mind that he was automatically right.
Yep.
Despite the fact that he had never really performed this task before. And then on top of that, saying to my superior, to our superior, well, Janae lies. And then, so I didn't say anything. I'm fuming because, I've been working on myself. I've been working myself.
You're a human. You're a human.
Because I didn't want to see red at work. Like I didn't want to see red at work.
Yeah. You
And
don't
so
want to be the angry Black woman.
right. And so not even 5 minutes later, she came back and he basically admitted that he made a mistake. And so I shouted over the cubicle. I said, "That's what happens when you call me a liar." And he didn't say anything because I don't think he thought that I heard him. And so when I went to my manager the next day, actually, she's a Latina, but she's definitely identifies as white, for sure. And so when I said to her, like, "Hey, like, I really didn't appreciate, the comment that Bill said to you," she brushed it off and told me that, "Oh, he was joking and da 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 da." And it was just like, no, that's not funny. That's not funny, throwing someone under the bus. And so those little microaggressions, or even macroaggressions, right? That you experience, they come often, they happen more often than not. But this guy in particular was very problematic. Like, I don't really think anybody particularly cared for him. People within the office and even people in our community-based organizations. Like, I think a lot of people, especially people of color, just avoided interacting with him because even though he put on a nice front at work, I wouldn't be surprised if he had like a Klan outfit in plastic in his closet. Like, I wouldn't be surprised if he just gave those vibes, right?
Oh yeah.
But he had to play nice because he's at work and he needs this job and stuff like that. So that was just an experience that I had where, I'm doing my job well, but I'm still dealing with, like you said, just these microaggressions or just these little things, while I'm trying to do the best that I can possibly do at my job. And it takes away from it and it makes you miserable in that space. By the time I left that department, that division, I was miserable. Like, I was miserable. And I was just like, I can't spend another 6 months here, another year. Like, I do not see myself growing in this space. And so I had to leave. And, a lot of people were sad. Like, and even how they treated me when I was leaving, they treated me like they fired me.
Wow. Okay.
Yeah, they treated me like they fired me because I was going to another department and it was a promotion. So with like civil service stuff, the department that you come from can block a transfer if it's like a lateral transfer, but if it's a promotion or a demotion, they can't block it. So since I had a promotion, they couldn't block it. And the director actually said, he asked me, he was like, "Oh, is this a promotion or a lateral?" And I was like, "Oh, it's a promotion." He was like, "Oh, you're lucky because I would have blocked it." And he like chuckled.
Wow.
Yeah. Like, this is probably like the first time I've talked about this in a really long time. Just because it was just like, I couldn't, all of the good work and the teamwork that I provided, how I, was always giving my best effort. And then I realized that towards the end of my tenure, I was quietly quitting, even though that wasn't a thing then.
Quiet quitting.
I wasn't going above and beyond because I felt like me going above and beyond, I was just being taken advantage of. I didn't really feel like, my superiors were really appreciative of the good work that I was doing. And so I started doing the minimum, like not the minimum, but basically like doing my job, still doing my job well, but not volunteering for any additional projects, not going above and beyond what was expected of me, but they couldn't say I wasn't doing my job, just because that space was so toxic, that I just didn't have the mental capacity to do it anymore. And so I think that when, with me teaching essentially the next generation of public health workers, and a lot of my students are also dual degree, like they're in a PA and PH program. degree program, we talk a lot about patience and just making sure, even though you would be in a clinical setting, you're still in a community. Yeah. So these things still apply. And so I just try to, especially in my leadership development class that I teach, just try to emphasize to them that to not be a part of like that toxic environment.
Yeah.
And what are some of the things that you can do to advocate for yourself if you find yourself in a toxic environment. But when you're in your 20s and you're just trying to be a team player, yes, it's for you to advocate for yourself. But when you're kind of like middle career, kind of like where we are, you're like, okay, y'all are on some bull crap.
Yep.
I know that you're not supposed to be doing this.
Yep.
You hold them accountable, and based off of like the first reaction that I get from a job, if I express my disapproval or if I have an issue with something, I take a mental note of how they respond to stuff.
Yeah.
Yeah. Because if I feel like it's not appropriate, or if I feel like they're not really addressing the root issue, I take a mental note of that in terms of if I even want to continue to stay here, if this tends to be the pattern at this work.
Yeah.
But yeah, I think that a good book that I would recommend to folks that are listening, or even I recommended to some of my students, was Medical Apartheid. Do you remember that book?
I remember it. I don't know. I feel like I have this book.
You do.
But I haven't read it in a while. I can't remember. I honestly can't remember. I can't remember.
Yeah, Medical Apartheid just talked about all of the racism in the history of medicine, especially in the U.S.
Yeah.
And there's a reason why people of color, namely Black and brown people, don't like going to the doctor.
Yeah.
There's a reason why they are questioning the COVID-19 vaccinations, or even the monkeypox vaccinations and things of that nature.
Yeah.
There's a reason behind it. And so this book clearly articulates case after case after case after case of things that were done, all for the sake of science, all for the sake of health, but who got the short end of the stick?
Yeah.
People that were poor, and that was often coupled by people that were Black or brown.
Yeah. And I think I was on a call, some like public health call about like COVID when it first, it was like, I guess it was like around like May of 2020, mm-hmm. maybe later, but it was in the year 2020, right?
Mm-hmm.
And they're talking about the vaccine, like when the vaccine comes out, and when there's a vaccine, we need to make sure it goes to like Black and brown communities first. And it was all white people on the call except for me. And honestly, I used to dread this call because I feel like whenever I spoke, like certain people just roll their eyes like, here she goes again,
mm-hmm.
Mm-hmm. But I was like, you have to be very careful about that. Like, of course we want things to be equitable, but I know the first thing my mother asked me when when they were talking about a vaccine, like, are we going to get the same vaccine as
mm-hmm. Mm-hmm.
Which is honestly, people might think that's a weird question. It's like, that's a very valid question, because this country has a long history of not providing Black people with the care that they thought they were receiving, the treatment they thought they were receiving.
Think about like the Tuskegee experiment, or even Henrietta Lacks, right?
Yes.
Especially Henrietta Lacks, right? And so I know with the COVID-19 vaccines, like the Tuskegee experiment came up a lot, and I had to really clearly clarify like what actually happened. So just, I'm preaching to the choir when I'm talking to you, but just for the Tuskegee experiment, it wasn't that the doctors gave these men syphilis.
Yeah.
These men already had syphilis, and there was an actual treatment for syphilis. But instead of giving them the actual treatment for syphilis, these doctors gave them a placebo, because their experiment was to see the duration of syphilis, just to see how it would have an impact on the body, from, getting syphilis to the time that the person dies, essentially. And so that was it's still an issue, right?
Yeah.
But that was one thing that I definitely had to clear up time and time again when COVID-19 first came on the scene. Just to let folks know, like, no, this isn't exactly like Tuskegee. But, but that it's understandable why you would be hesitant to take a vaccine.
Yes.
And then also there was a doctor, a Black woman doctor named Dr. Alice Stafford. I'm sorry. She's a Penn State alumna too, and I'm blanking out, right? So she is a medical doctor in the Philadelphia area, and she saw that, especially in the early stages of COVID, the people that were getting COVID versus the folks that were getting tested was not matching. Like the math wasn't mathing, right? Yeah. And so, she had reached out to the city of Philadelphia. She had reached out to the health department like, hey, I want to start testing Black communities in Philadelphia, blah, blah, blah. The health department wasn't really trying to work with her. And so Dr. Alice Stafford, I'm going to say Stanford. We're just going to say Stanford for today. She started something called the Black Doctors COVID Consortium. And so she partnered with mega churches, essentially, in the Philadelphia area to provide COVID-19 testing and eventually COVID-19 vaccines. Yeah. It actually started with her being in a van. She hit up the federal government and any other resources that she had access to get the COVID-19 test. And her and her team were actually started off going door to door in certain zip codes. And then as they saw the demand grow and the city then got on board, like, oh, let's help you out. And the feds were like, oh, let's help you out. And it's always after the fact, right?
Yeah.
But she partnered with these churches. And I can honestly say that's where I got my initial 2 doses. That's where I took my grandmother. And when you were in these lines, you saw mass majority Black people because they were providing tests and providing vaccines in Black spaces. And they trusted the pastors that were the pastors of that church. Yeah. In addition to trusting this doctor, this woman, this Black female doctor. Yeah. And so I just thought that was amazing. She actually even has they even named the street after her just because of the impact that they, a block after her, just because of the impact that she's had. And she's actually opened up a clinic within one of those churches that they did HIV testing. Was talking about HIV, but COVID-19 testing. Yeah. And so that's a really dope example of kind of turning lemons into lemonade, right? Yeah. Where you see this need in your community and the powers that be are kind of like, oh, well, Black people don't want to get tested. They don't want to get the vaccine. Mm-hmm. So we're just going to test whoever we can test. We're going to test whoever wants to get tested. But we saw with the Black Doctors COVID Consortium that it's not that we didn't want to get tested. Yep. We just don't trust the government. Yeah. We don't trust the health department because even with the health department clinics, right? The people always complain about the quality of care. Yep. They always complain about the wait times. So if folks are already exposed to the services that you're going to provide, why would you think that they would expect more of you just because it's a pandemic? Right. And so the Black Doctors COVID Consortium really truly showed that if you know who your stakeholders are and if you're a part of the community and you establish that trust, then you can get stuff done. So many people got vaccinated because of this initiative that probably would not have otherwise if it was based off of just what the health department was doing. But on the flip side of that, right, there was I can't even remember what the name of the entity was, but it was ran by white men who were basically recent college grads, right? Yeah. And so it turned out that especially with the COVID vaccines, they weren't disposing of them properly. They weren't storing them properly. They were having like COVID vaccine parties for like their friends. And they were getting all of these funds from the city, and the city was partnering with them. But it was like nobody was a doctor. Yep. Nobody even had like a public health degree, but y'all didn't want to work with Dr. Allah? Yep. Really?
Oh yeah, I remember this story. I brought it up. I brought it up on a call.
Yeah, so it's just like that. Even within Philadelphia, which is not only the city of brotherly love, but also sisterly affection, right?
Yep.
We saw firsthand in 2020, 2021, the racism that happens even within the system. Because the fact that they even gave these fresh out of undergrad white men all of this money.
Yep.
And it comes into like, all right, like whose dad is in government? Like whose dad is like an elected official or somebody higher up? But it just speaks to just the racism and the prejudice with the system.
Yeah, how did he get in that room, right? How did
no idea.
22, do you even get in the room?
No idea.
With officials that can give you government funding.
So
I guess he gave one slick PowerPoint, and they're convinced.
It must have been the best presentation that they have ever seen in their life.
Listen, I worked at a consulting firm, and let me tell you, those white boys, they can do a slick PowerPoint.
Yeah,
there's nothing else behind it. Zero experience, but there's something on.
They're consulting for sure. For sure.
Zero experience in healthcare, but they're consulting with the federal government. Sorry. Zero experience in healthcare, but they're consulting with the federal government. Public health, right out of undergrad. And so you see it and you're like, okay, this is what they're used to, right? They're not used to seeing or of course they've seen intelligent Black women, but I think there's a refusal to truly see you, right? Mm-hmm. Truly see you as you are.
And what you're worth.
Yes.
Mm-hmm.
Because that's not how they were raised, right? Communities in the United States are segregated by design, right?
Yeah, talking about health policy, redlining, health disparities, poverty, gun violence, all of those things are in the same spaces. So if you talk about redlining where, banks only gave mortgages and then mortgages at high rates in certain areas, you'll see that those are areas that have the highest poverty rates, the highest rates of gun violence. They have the highest rates of food deserts and things like that. It was not an accident. It was by design. And so when you kind of get it into folks' heads that this is not by accident, like this is not by chance. Like this is something that we talk about in epidemiology all the time. Like this causation is not by chance, right? Like there's some deep-rooted issue that has impacted this exposure and has caused this illness that has caused whatever it may be. So another example that happened recently within the last couple of years. So let me backtrack. So in 1985, I wasn't born yet. Don't say anything. In 1985, there was something that happened in Philly called the Move bombing. And so unfortunately, the city of Philadelphia, the police department actually dropped a bomb on a city residential block because they had a standoff with, I guess you could say, an eccentric group because they had a compound and there were children that died from this, parents and so forth. And so fast forward to 2020, 2021, something gets leaked that the current health commissioner, Dr. Thomas Farley, when he first became the health commissioner in Philadelphia, he was told how University of Penn, I think it was University of Penn, still had the remains of the Move, like the bones of the Move bombing victims that nobody knew that they had. And Dr. Thomas Farley told the folks that worked for him to destroy them, to cremate them, and not to tell anybody. So when so basically there was a whistleblower. So whoever Thomas Farley told to do this, they were like, nah, this ain't right. This isn't right. Yeah. And so they essentially leaked that these remains were still in existence, and that the health department had them for 30 years, like 30 plus years. And so the family now has those remains, but the fact that you are the health commissioner. Yeah. We talk about equity, we talk about justice, we talk about all of these things. And the fact that you came into this new city, he came from New York City. So imagine what he could have possibly done in New York. Yeah, but
he wasn't a Philadelphian.
Came from New York. You come to Philly, and one of the first things that you tell your workers or the folks that are under you to do is to destroy evidence or to destroy the remains of someone's loved ones without giving them a proper burial. How sick is that? Yeah. And this is supposed to be public health. He's a medical doctor. Yeah. He's a medical doctor, and he did this within the past 2 years. And so when we say that these things exist, these are the type of things that people don't even really know about unless it's put in the news. And then even still, a lot of people don't even know about it, right? Oh, yeah. And so those are just recent examples that I can think of in regards to just on a systemic level, just racism in health, racism in public health in this wonderful city of Philadelphia.
I mean, and all over. I mean, I think people assume that, medical doctors aren't racist or that they're on some pedestal. And I think, I believe one of our classmates, Dominique, said this, and I won't ever forget it. She said, MD stands for most deified.
Ooh. That's a good one. I'm going to have to text her and say, girl, did you say this?
She did. She's like, MD stands for most deified. And I was like, oh, wow. That's true. And there's a culture in medicine and healthcare of like, you can't question a doctor. There's a lot of doctor worship. And so it's not surprising, especially when you deal with doctors that are racist. And a lot of them are, because they're not addressed in medical school. Hell, you read medical textbooks that say that Black people have thicker skin and are less sensitive to pain.
Thicker skin. You have higher tolerance. Yeah.
They're still in circulation. So where does racism come from in medicine? How does it get there? Like, it's in the book. It's literally written in. Like, you can find medical textbooks that are still being used in medical school, nursing textbooks still being used in nursing school that will tell you all sorts of things about Black people, Arab people, Asian people, and say they tend to be like this, that literally other anyone who isn't white. Right? You're not white, you are othered, you are different, you are weird. I had a friend, they told her that because she was like, oh, we know, like, she was a Black woman. So they told her husband, who they thought was white, they told him, they said, hey, we know she brought the baby in this week. Thank you for that. But we also know that Black people have a tendency to overbathe their babies. You don't have to bathe them every day. She said this. She didn't state what poor health outcome results from overbathing, whatever overbathing is. So bathing once a day apparently is overbathing the baby. She didn't say that. She said Black people just tend to do this. Basically, this is what you're doing. What Black people tend to do is in opposition to what white people do, and therefore it's bad. And I think that's part of each step throughout public health. You see that in medicine. If it's outside of this norm, and the norm is it's odd, it's strange, it needs to be corrected. And then you see it play out in public health, right? In terms of what is healthy, right? What is the appropriate way to raise children, appropriate way to eat healthy food, appropriate way to get transportation, get to work. It's all based on
what are considered adverse childhood experiences.
Yes.
I'm just like, I feel like is being Black an adverse childhood experience? I feel like everything else on this list we all experience.
Yes.
Yeah, I think that reminds me of there's actually a medical student that has a TikTok. I forget his name, but he actually talks about medical facts and just to address like racism like in medicine. And so I know that he would show like, you know, what he would see in his textbook in terms of different ailments, especially like skin-based diseases or communicable diseases and things like that. But on his TikTok, he would actually show what they look like on darker skin, on black skin, on brown skin. And so, you know, this is just him seeing the need while he's in medical school, and he has a huge following. And of course, he talks about other things, but the main thing is just addressing like health disparities and racial disparities in terms of health outcomes and just healthcare services. And so I say all that to say, I think the kids will be all right. If we have folks like him, I think the kids will be all right. I think they'll be all right.
I hope so. I really do. I'm like, you gotta call these doctors out, because I mean, like, that's a whole other thing. I think when you start working, like, at least for me, working in the healthcare system, working in a hospital, working with doctors, I became very stressed out because I was like, I don't ever want to be like in a serious accident, and that motherfucker right there is supposed to be taking care of me. I'm like,
yeah.
Like, I have that. It's a recurring nightmare of mine. Like, I'm like, oh no.
And you know, and that's. We actually saw, you know, when people, I forget what they call it, when match day for like doctoral students, when they get matched to different programs and stuff. This past match day, we saw like an unprecedented number of Black doctors or black doctors essentially being matched into OBGYN programs. Just because, and also pediatrics, you know, general practice and stuff like that. You know, a lot of the places where you're not really getting the most money per se, because it's not super specialized like surgery or whatever the case may be. However, I really feel like a lot more of these folks that are in doctoral programs, whether it's DO, MD, whatever, are being intentional in terms of going where the need is. And also being in certain spaces where your clients or your patients aren't necessarily going to see too many people like you.
Yeah.
And so, you know, speaking about our good friend Dominique, she went back to her hometown of New Orleans. She got matched to Tulane, and there was like a big thing that happened right before she went to Tulane, because they replaced the head of that program, who was a Black woman, with this white man that didn't have the background. He didn't have any of the things that this woman had, and they replaced her. And so that was like a huge thing. And they started talking about just like racism within the program. Now, granted, anybody that's from New Orleans or is New Orleans adjacent knows that Tulane has a history of racism. It's not a surprise. But I think that with them just overtly removing this woman from her post without really any true explanation, like I can't think of like the actual what happened step by step, but I know Dominique, like, she went to this program specifically for this woman because she knew that she had established a relationship with that woman. And so, you know, I'm sure she was getting the tea behind, you know, everything that was. But they really, Tulane's medical center really got a lot of pushback for that decision, because it was clear that it was prejudice and it was sexism and it was racism. Yeah. And so, in terms of why public health is so racist, I think, or at least in this country is inherently racist, right? And so until we can fully address how our systems are plagued and it's racism is intertwined in every corner of our systems, until we can address that, we're not going to address racism in health. We can start like one person at a time, But systemically, it's not going to happen until this country addresses its problem in general.
And when you say that thing about that woman being replaced, I feel like that's a story of like every where I've seen a Black woman get into a leadership position, right? Even going back to Nicole Hannah-Jones with what was that, UNC?
Oh yeah.
Right? A few board members didn't want her to have tenure, and that happens time and time again. There's always someone, but when I worked in public health academia, I won't say the certain public health association, it's always like a certain dean doesn't like you, a certain VP in the association thinks that you're bringing too much change. We want change, we want equity, but we want incremental change, not too much.
I'm pretty sure.
And all of a sudden, those Black women are gone. That Black person's gone. That Black woman's gone, and like no one knows why. We don't know why, right? And it's always the same old story. So, especially in DC, like I'm based in DC, you're based in Philly. I'll see Black women get into like these, they'll become the CEO, the COO of these nonprofits in DC that have always been historically white, all white leadership. And because they actually suddenly they want to look like the communities they're serving, a Black woman will get into leadership, right?
It ends up having.
I'm always like, how long is it going to last? How long are they going to allow her to be here?
Right.
And the key word is allow.
Right.
Because it's going to have nothing to do with whether or not she can do her job and do it to the best of her ability. In fact, if she's really good at it and she's making great change, then she better really watch out. That's what I know. That's my experience. She better watch her back at that point. Right?
So do you think like a solution would be for us to establish our own institutions, similar to what Dr. Alice Stanford did?
Yeah, I think that's part of it. I think we need strong unions too. Like, I don't think that you should be able to have these nonprofits that get all this federal funding should reflect the federal. I'm not pro-federal government, but reflect it in the federal government, there are unions, right? You're getting federal funding. Why shouldn't you be held to the same standard, right?
Yeah.
As the federal government, in that, no, there are going to be unions. No, there's going to be, that's not even an option. The unions will be formed. No, you can't block SEIU, AFGE from a union here.
FE, all of them,
right? Right? Like that, we need that in terms of equity. There has to be some type of, you have to be able to have a way of upholding the laws of this country. Like, these labor laws exist, but what's the point of them if you can't enforce them?
And I think this is actually something that I'm actually taking a class at Hopkins called Policing and Health. And I had mentioned unions because on the discussion board, one of my classmates said they need to get rid of the police unions. And I can see how, police unions can be problematic, but I flipped it and I was like, no, not necessarily get rid of unions, because I think that unions are important, but putting language in the contract that holds them accountable for certain actions. So that way, when they conduct themselves in that way, oh, you went against the contract, so these are the repercussions for that. And at the very least, even if it doesn't change them on the inside, it's going to change how they act on the outside, right?
Yeah, exactly.
And so that's just one thought. But yeah, I think that a lot of these nonprofits should be unionized. I know that AFSCME is one union that really does a lot of that, which is under AFL-CIO. And so I know even some of the community-based organizations that we give funding to, some of them are unionized. And so you have the unionized workers for certain positions, and then you have the non-unionized workers, which tend to be the part-time or whomever. And so I definitely see the difference in terms of how much money they're receiving compared to the other organizations for people with the same position, and all of those things. So I definitely feel like unions are important, because ideally they historically have put in place a lot of brought the humanity back into working, right?
Yeah.
And having employers realize we are not machines, we're people, We have lives outside of work. We have children. Some of us have outside of work. Well, millennials not really having children. I feel like I'm like one of the few of my friends that have kids. Raising teenage girls, 0 stars, wouldn't recommend. Anyway, but anyway, but there are a lot of these nonprofits, and there are a lot of unions that would love to unionize these spaces, but oftentimes there's that fear factor that's brought into it, that plantation mentality that I kind of talked about before, where especially if you're like in a right to work state, or you're in like a right to work like position where your employer can fire you for essentially anything, unless you're in a union, right? Where they can't fire you for just sneezing too loud, right? Or just being annoying, or things of that nature. And so I definitely think that that's a good point in terms of even unionizing and putting like certain language in there, because if the organizations themselves aren't going to hold supervisors or their workers accountable, then unions can do it. If you have proper union representation, right?
Yeah. Absolutely. And I want to jump onto one other topic as well, because I thought about this, public health workforce. When I first got my job in public health, I remember being at a conference, and they kept saying that. Didn't we know, like, they really get it? They've done Peace Corps, done AmeriCorps, like, they understand. And I was just sitting there like, confused. I was like, wait a minute. How much does Peace Corps pay? Right?
Crumbs.
And if you have a child, can you do Peace Corps? No. If you have, other obligations, people that are dependent on you, which I know like a lot of us do have that, right? Can you do Peace Corps? Is that really feasible for you? Is AmeriCorps feasible for you? No, not at all. These are damn near unpaid. Like they say, it's someone argued with me online. They're like, it's paid. I'm like, oh,
it's expensive to be $5,000
at the end of 3 years. I was like, okay, like, I was like, that's not paid. That's not paid.
Yeah.
That's not paid. And like that was the basis for how they were hiring. That's how, and they were all resounding like, yes. And that's why, like, those same organizations, those same nonprofits will be like, we're trying to make it more diverse. I was like, really? You are? Because the applicant pool that you're using is of people that can afford to do an unpaid internship. They can afford to make as little as $10,000, $15,000, $20,000 a year, if that, right? Sometimes without benefits, right?
That's making my stomach hurt.
Yes, and I'm like, so if I somehow make that work, let's say I'm child of a single mom from Mississippi, if I make that work, I'm already set back financially, right? Like my family was literally owned in the state of Mississippi. Literally, they were owned, right? You're setting me back financially, so you're literally reinforcing systemic racism, but through like paying me, a Black woman, poverty wages, because paying me that is not the same thing as paying, my white counterpart whose dad is a dean, right, at Columbia or Princeton. It's not the same.
Right.
It's not the same. There's nothing equitable about that. And yet in public health, the deans in the schools of public health, professors in schools of public health don't necessarily see anything wrong with that. They praise it. Those people get advantages. They get extra points when they're applying for government jobs, and they're applying for other jobs in nonprofits. Like they are the cream of the crop. They're considered to be the cream of the crop, right? And so right then and there, you see it, and you're like, oh, okay, haven't we?
Mm-hmm.
You're supposed to be teaching me. Y'all are the leaders in this field, and that's how you hire. That's how you determine who gets entry-level positions.
I mean, I think it's more so in like community-based, like public health spaces. Entry-level work they pay poverty wages in general in public health. So it's kind of like a slap in the face, because we talk about, how income is important, and financial stability, impacts health, and how expensive it is to be poor. But yet you're trying to pay people with master's degrees $30,000 a year.
Yep.
Like, make it make sense. But in terms of just moving forward, I do have hope.
Yeah.
Only because I think that COVID-19 truly exposed the inadequacies of the public health infrastructure.
Yeah.
And if folks don't want things like this to happen again, they have to address it. We can't continue to kick the can down the road anymore. We can't continue to throw money at problems like throwing spaghetti on the wall and just seeing what sticks, which is essentially what people in leadership thus far have been doing.
Yeah.
And so I think when you have this new generation of public health workers that have higher levels of education, that have more diverse backgrounds, that kind of pushes the field into a space that we've never been before. And so that's what I'm kind of looking forward to.
Yeah, definitely. It's literally life and death at this point.
Yeah.
It's like we have to get our act together. I always say that, like, my mission when I talk about these topics, it's not to complain. It's really it's selfishness. It's like, I want to go to a hospital and feel perfectly safe in that hospital and feel like I'm going to receive great care, right?
Yeah.
And know that if something goes wrong, I know exactly there's someone to answer to, right? There's a place I can go to where it can be addressed, it can be fixed. There's some level of accountability, right? And they're going to try to fix it, right, if they can, right? And that there is accountability, there is safety, there people are following, standard operating procedures, and that people that are traditionally marginalized are centered in that, right? Like, so, I can trust how my mom's gonna be treated when I'm not at the hospital with her. So that's my hope. Like, I think I do this for selfish reasons. I think I'm in public health for selfish reasons. I'm like, no, I want to be safe when I go. I want to be safe. I want my kids to be safe. I don't have kids, but if I did, I want them to be safe. I want those that I care about and love to be safe. So considering all this, what advice do you have for any young Black women that are considering going into the field of public health? So what advice do you have for Black women that are interested in public health?
So I actually had a conversation this past summer session with two students who happen to be Black women. One who comes from, I want to say, the Ivory Coast. I think the Ivory Coast, because she speaks French. I think they speak French. And also one who identifies as being a Black American. And so they were basically dealing with imposter syndrome. And so I put like my big sis / auntie hat on, and I was like, look, I'm not just your professor. We're all Black women here, right? Yeah. And at the end of the day, you're in this space for a reason.
Yeah.
Whether it's a job, whether it's a academic program, whether it's a volunteer project, whether it's an initiative, you are in that space for a reason. And so do your due diligence in regards to what you're there to do, but also do not allow yourself to be taken advantage of.
Yeah.
Learn how to advocate for yourself. And if you do not know how, ask someone who is older and that you trust how they do it for themselves, especially if you know that they're a person that would advocate for themselves.
Yeah.
Because at the end of the day, I would hope that everybody that is in public health is doing it because they want to help people, right?
Yeah.
Because if you don't want to help people and you just want to make money, this is not the realm that you want to be in, right? And so the thought is that everybody wants to help people. And so if you focus on the bigger picture, because at the end of the day, I ran for office, and I tell folks all the time, like, I'm engaging in politics or engaging in an elected office because what did I get all these degrees for?
Yeah.
If I'm not going to contribute to making my community safer and improving just in general the quality of life of my hometown. So when you know what your goals are, focus on those goals. If you don't know what your goals are, establish goals. And so, and also confide in a space that you feel safe in. I know that there's like there was a group, what was that app that people were going on that was like kind of like a chat room during the beginning stages of COVID? I forget. Yes. There was like a Black women in public health group. I have to figure out like if I have the contact information for some of those folks. But even in that space, find people that get you.
Yeah.
Right. And I know for real, that's probably a reason why many people stay at jobs that they hate, because they're working with people that make them feel safe. Yeah. People that they can identify with, people that even if the work is grueling and tedious, that it makes it a little bit better because they're experiencing with that person. Yeah. And so that's just a little bit of tidbits of advice that I would give any Black woman that's coming into this realm. Will you deal with microaggressions with people that you work with and with people that you serve? Sure. But at the end of the day, just know that it's not just you, and that there are people that are there to have your back, whether it's in the space that you work in or outside of the space that you work in. You just have to tap into it.
Yeah. And support unions. Woohoo!
Yeah. Oh, unions. Yes.
Well, Janae, thank you so much for joining us. It has
no problem.
A pleasure. And to close out, I want to thank everyone for listening in, and to ask you all to please write in about any questions, comments, or concerns. And if you think you're really good at, send in some answers. Be sure to follow She Really Gets It on YouTube, Spotify, Apple Podcasts, and wherever else podcasts are found.